Thank you for choosing Inova Loudoun Hospital for your upcoming procedure. We value the trust you have placed in us for your healthcare needs. Our dedicated team of healthcare professionals look forward to providing you with the highest quality care and exceptional service in a safe and caring environment. We understand that you and your loved ones may have many questions regarding your stay with us, whether it be overnight or just for the day. Our goal is to provide you with all the information needed to prepare yourself for your procedure. We welcome you to Inova Loudoun Hospital. On the day before your procedure, you will receive a phone call from the Surgical Services Department confirming the start time of your procedure and your expected arrival time. Disregard any other times you were given, as it is not unusual for the surgery schedule to change up until the day before your procedure date. On the morning of your procedure, wear comfortable, loose-fitting clothing that will be easy to take off and put on. Leave all jewelry and valuables at home and bring only your insurance card, identification, and a copay payment method. Be sure to allow enough time to arrive at your scheduled time to reduce the chance of unnecessary delays. After signing in at the registration desk, a registration representative will assist you with the registration process. Our friendly and knowledgeable registration staff will assist you with any insurance and copay questions that you may have at this time. The registration representative will escort you to your private pre-operative room to complete the registration process. Your own personalized healthcare team, assigned to you in the pre-operative area, will introduce themselves and begin the pre-operative process. The registered nurse will review with you your complete medical history, your medication list, your plan of care, and equipment used. Our highly skilled pre-operative staff will also initiate your IV using a numbing medication to minimize any discomfort. Our pre-operative rooms have bathroom facilities available for you to use prior to you going into the operating room. We will also supply you with warm, soothing blankets. After the pre-op RN has completed your pre-operative interview, your assigned anesthesiologist will introduce themselves to you and explain your anesthesia plan of care. You will also be greeted by your assigned CRNA, a highly trained advanced practice nurse specializing in anesthesia. Your surgeon will see you in the preoperative area to answer any questions you may have, review the surgical procedure, approximate length of time the procedure will take, and obtain consent signatures. When the operating room is prepared and ready for you, the operating room RN will introduce themselves to you, review your operating room plan of care, and along with the CRNA, take you to the operating room. Once you are taken back to the operating room, your companions will be escorted back to the surgical services waiting area, where they can relax in a comfortable atmosphere, enjoying complimentary coffee and free Wi-Fi. Powered workstations are available for use, as well as personal electronic device charging stations. Throughout your procedure, your companions will be kept informed of your progress. Your companions will also be able to track your progress with our tracking board located in the surgical services waiting area. The tracking board will be explained in detail to you and your companions by the pre-operative staff. Once you arrive to the recovery room, your nurse will call and update your companions about your arrival and plan of care for recovery. While in the recovery room, a specially trained RN will be monitoring your vital signs, breathing and circulation, and making sure you are comfortable. Since all patients are different, time in the recovery room will vary and could be up to a few hours. During this time, the recovery room RN will be updating your companions on your progress. Once you have met criteria to move to our Stage 2 recovery area, your companions will be called back to come sit with you while you continue your recovery. Here, you will be given something to drink, and some will be given a light snack. The Stage 2 RN will go over your discharge instructions with you and your companion, highlighting important aspects of your healing process. While in Stage 2, our caring nursing staff will ensure that you are comfortable and make sure that you and your companions are prepared for continuing your recovery at home. It is important to remember that you will be tired for the remainder of the day and will be ready for discharge once you reach your comfort goal. Any nausea or bleeding is controlled, and you are taking liquids orally. The third stage of your recovery happens at home, where you will continue the healing process. You and your companion are home, but not alone. A registered nurse from our staff will call you the following day of your discharge to check in on you. answer any questions you may have, discuss your comfort level and medication regimen. Thank you for allowing us the privilege of caring for you while at Inova Loudoun Hospital.